Good evening.
Good evening.
Good evening.
Good evening, everyone. Let me start by sharing my screen. We'll be starting shortly. Can someone please confirm they can see my screen?
Yes, I can.
Okay, thank you. So my name is Nabila. I am part of the BBYI team, which stands for Barrier Breakers Youth Initiative. And I am an SRH advocate, which is basically a sexual and reproductive health advocate. I'd like to thank you all for coming today, and I'm going to try and keep it as short as possible and allow my co-speaker to continue after I'm done. So feel free to ask any questions through the chat box or simply by unmuting yourself. Okay, we're going to start. Sexually transmitted infections. I'm sure we've all heard about this. Infections, and we can name a few of the infections. So please participate and make it a bit interactive, and hopefully you get to learn something at the end of it all. So can we name a few of the STIs we know of?
HIV.
Yes, HIV.
Hepatitis B.
Gonorrhea.
Gonorrhea.
Chlamydia.
Chlamydia.
Syphilis.
Syphilis, good. Let me see if I can see the chat box. Yeah, syphilis, gonorrhea. Nice. Okay. Oh, sorry, oops. Okay, so an STI is basically an infection that's spread through unprotected sexual contact. And it could be transmitted via vaginal, anal, or oral sex. Usually when we say unprotected, we mean without a condom. But for oral sex, instead of condoms, you can use dental dams, which are certain materials that can be used as a physical barrier. But I don't think they're that common. So this is how you can pass the STI sexually, through these three methods. So when you look at this slide, there's a lot going on. When you think of an STI, sometimes it's used interchangeably with STDs. So when it's an infection, it can either show symptoms or not. It's at least, usually symptoms are present. So when you think of an STD, you think of AIDS, you think of HIV, which now is the virus. Think of herpes, you think of pregnancy, contraception. There's so much that that is affected by STDs. So this slide was just trying to capture all the things that you could think of. And we will see that most of these symptoms for STIs usually overlap. Then they're so common among so many STIs. So you get unusual discharge that can be from the vagina or penis. There's also pain when you're urinating. It could also occur when you're having intercourse itself. You can also have pain in your lower belly. There are sores, blisters, warts, lumps, or even rashes around the genitalia. You could also experience a lot of itching and also swelling, some inflammation in the genital region. Apart from that, you could also have bleeding, more common in women during or after sex. And women can also experience fever. So when there is fever accompanied by the lower abdominal pain, it's very serious. And we're going to see what kind of STI can manifest that way. So these are just some of the symptoms you'll see as we go on. They overlap in the different STIs we're going to cover. Okay. Are we still together?
Yes.
Yes.
Okay, good. Oh. So the first STI we're going to cover is bacterial vaginosis, BV for short. Normally, it's characterized by overgrowth of bacteria found in the vagina. So normally there's bacteria in the vaginal region, but now when there's an overgrowth or there's some sort of imbalance, that's when bacterial vaginosis can occur. So some of the risk factors include multiple partners or unprotected sex and douching. Normally the vagina cleans itself and people are advised to clean it using water only. So when you introduce certain chemicals or other fluids that do not include pure water, you can end up getting infections. Bacterial vaginosis can be asymptomatic or asymptomatic. That means it can either show symptoms or not. Some of the symptoms include a fishy odor, itching in the vaginal region, thin gray or white vaginal discharge, or burning sensation when you're urinating. And when it occurs during pregnancy, it can be quite detrimental because it can lead to preterm babies. So babies that are born before the time they're supposed to be born, or babies born when they have a low birth weight. So that's why pregnant women also go for screening for STIs. Because as we've seen, these STIs can show symptoms or not. So someone may be having an STI but doesn't have any symptom. So when you have bacterial vaginosis, your chances of getting STIs is increased, such as gonorrhea or HIV. So we go to the next one, which is pubic lice. It's also known as crabs. And why it's called crabs is because this louse, because lice is the plural form of louse, yeah? So this louse, which is shown in this picture here, resembles a crab. So that's why it's called crabs. So from the name pubic lice, it's usually found in the pubic hair. It can be found in other hairy areas like the armpits or even eyebrows, but mostly it's in the pubic region. It's transmitted by skin-to-skin contact. But here's the catch, condoms cannot help prevent this because condoms don't cover the whole genital region, you know? So one can be able to transmit this despite using condoms. And it's majorly characterized by itching, yeah? So these lice eggs can be easily seen. They can even be seen crawling in the pubic region. And when you see pubic lice on the head, especially the eyelashes or eyebrows of a child, could be an indication of sexual exposure or abuse. So it's quite important to look into that if you ever come across that case, pubic lice on the head of a child. As we've said, condoms cannot protect against the transmission of pubic lice. Okay, we go to chlamydia. Chlamydia is caused by a certain bacteria, and it's transmitted sexually through the 3 different ways: oral, anal, or vaginal sex. It can also be transmitted vertically, and when we say vertically, we simply mean from a mother to a child during childbirth, or it can even be during the pregnancy itself. And it can also be transmitted through direct contact through the infected tissue, and you can transmit it to the eye. Conjunctiva is just a part of the eye. I believe most of you know that. And in women, it manifests itself different ways, but we'll later on see that chlamydia in women is mostly asymptomatic. So a lady may be having chlamydia and she doesn't know. Yeah, but some of the symptoms that are common in chlamydia in women include pain during sex, which has this medical term called dyspareunia. Is also abnormal vaginal discharge, which is very common in many STIs. Is also abnormal bleeding after sex or between periods. Okay, I don't know if you can see this, but this is another symptom in women: fever, pain when peeing, which is basically dysuria medically, abdominal pain, and other complications. So, chlamydia, if it goes untreated, it can lead to serious complications such as PID, which is pelvic inflammatory disease. My colleague is going to talk about it later today. And this pelvic inflammatory disease can predispose one to infertility, chronic pelvic pain. So the pelvic region is just the lower abdominal region around the genital region. So you can have chronic pain that doesn't go away and lasts for a very long time. And this pelvic inflammatory disease can also lead to a lady getting ectopic pregnancy, which is very undesirable, yeah? Because you want the fetus to be growing in the uterine region, not in the regions outside the uterus, which in this case, ectopic pregnancy could be in the fallopian tubes, yeah? So chlamydia needs to be treated, but the good thing is that it's easily treated using certain antibiotics. And in men, how it manifests itself is through abnormal discharge, fever as well, burning sensation during peeing, painful swollen testicles, and if untreated, it can also lead to infertility. So it can lead to fertility in both men and women. As we've said, another way to transmit chlamydia, it could be directly carrying it from an infected tissue to another part. And more commonly, it's usually the eye. So it can affect the eye, leading to a condition known as a trachoma, and can also affect the joints. In pregnant women, it can lead to spontaneous abortion, premature birth, and eye infection in newborns. As we've said, the treatment is with antibiotics, not just any, there are specific antibiotics in the guidelines. Okay, we go to the next one, which is Chyproid. It's also a bacterial STI, and it usually manifests with symptoms within 2 weeks. Some of the risk factors include commercial sex workers and also endemic areas. So areas that are prone to people getting chancroid. Circumcised men are at a lower risk, and it is transmitted sexually, hence the name STI, through direct contact with lesions or autoinoculation to non-sexual sites. So just like chlamydia, chancroid can also be transmitted to other areas that are not the genital areas, such as the eye and even the skin. It normally starts as a papule. A papule is simply a raised bump on the skin. So it's kind of like a pimple, yeah? So a papule is how it starts. Then it moves on to become a pustule, which is basically a pus-filled papule. Then it becomes an extremely painful ulcer. This is very important to note because we're going to see syphilis is painless. Syphilis manifests as a painless ulcer, but chancroid is extremely painful. Yeah, so, hello? Okay. So chancroid is extremely painful. So that's a key point to differentiate it from syphilis. So as you said, starts as a papule, then a pustule, then a painful ulcer. Clinically, it's mostly asymptomatic in women. Women may have pain when urinating or during intercourse, and they may also experience vaginal discharge. So it's mostly asymptomatic in women. And lesions here are termed as soft chancres. The ulcers may be single, mostly in men, or multiple in women. This is because, when you look at the male genitalia compared to the women's genitalia, it's different. So for the women, the genital area is mostly external, but for women, it's internal. So for women, since it's internal, and we have the labia, which are the lips of the genitalia in women, they may, if one has an ulcer, it can transmit the infection to the other lip, causing 2 ulcers. So women are more likely to get multiple ulcers, while men normally get 1. And this infection can lead to swollen lymph nodes, which may rupture. So this is just a scientific name, not really important in this situation, just called buboes. But the lymph nodes are just areas in your body. They're found in different areas, and usually they have white blood cells that help you fight infection. So these lymph nodes may get overwhelmed by the infection and become inflamed. They may become swollen. So you'll see around that groin area, especially in men, they can get swollen lymph nodes. You'll just see areas of swelling. So key thing, chancroid has extremely painful ulcers. Okay, we go to syphilis. So syphilis has a very long incubation period, which is basically the time before you see the symptoms. So it can be from 10 to 90 days, so 3 months. And the transmission is majorly in 2 ways. You can have it transmitted congenitally from the mother to the baby. It can be acquired through body fluids via sexual contact, contaminated needles, or contact with skin lesions. So we'll see that syphilis has different stages, and therefore it's important to follow up even after treatment, just to make sure that it has been eliminated. So it's advised to go for follow-up not every 6 months, just after 6 months, then 12 months, just to make sure that you still don't have that infection. We're going to now look at the different stages in syphilis. So there are 4 stages. We have primary, secondary, latent, and tertiary. So primary mostly starts with a painless sore. So it's normally hard. In chancroid, we saw it's painful and it's also soft. But in syphilis, it's hard, painless, and it's also called a chancre here. You can simply call it a sore. So it starts small, it starts as a papule, which we said is like a raised bump. Then it progresses to a chancre. Then secondary syphilis usually is seen as a widespread rash all over the body. We're going to describe it further as we go on, but basically, the rash normally starts in the trunk region, basically your chest or back, that region, and then it goes on to your hands and feet. Normally, the rash is seen on the palms of your hands and the soles of your feet. We're going to see how that looks like. And latent syphilis is basically the stage when there are no symptoms at all, no visible signs or symptoms. And it's kind of you can call it a dormant stage. Then we have tertiary or systemic, which is by far the most serious stage. Various organs are affected. Here we have the heart, so someone may end up having heart issues. The eye can be affected, the brain, the spinal cord, the liver, joints, and the spinal cord being affected can lead to paralysis. So this is just a point to note. Pregnant women should receive syphilis testing at least once during their pregnancy. This is a diagrammatic summary of the stages. So we have stage 1, 2, 3 here. The latent stage has not been shown. So the first stage, you can see there's a sore, and we've said it's painless, and it can occur within 90 days after exposure. Stage 2 usually occurs 4 to 10 weeks after initial infection. So stage 2 can actually overlap with the sore after the sore has come. So this is how the rashes look, and they're mostly on the palms of the hands and the soles of the feet. Then stage 3 can also be called the systemic stage, where other organs of the body are affected. And these effects can appear years after initial infection. So that's why once you see such a presentation, it's always good to get medicine, because the sore can resolve and then you think you're okay, but later on, years to come, you get that this infection has manifested in other organs of the body. So this is just more information on the primary stage, some of which we've already mentioned. Basically, the sore appears at the location the bacteria entered the body, usually on the genitalia, lips, or even the mouth. Remember, there's oral sex as well. And even after the sore heals, one should receive treatment to prevent progression to the secondary stage. Secondary stage, we talked about the rashes, and you can have other symptoms like fatigue, headaches as well. And the latent stage, this is where we said there are no visible symptoms, and it occurs at different times. It can occur between the primary and secondary stage, or just in between the secondary stage. And finally, tertiary stage can occur 10 to 30 years after infection. You can see that's a very long time, and it's characterized by organ damage. So these are the various organs that can be damaged: the heart, blood vessels, eyes, brain, spinal cord, liver, and even the joints. Okay, are we still together? Let me just confirm.
Yes, we are together.
Yes, we are together. We are together.
Thank you. Okay, we go to hepatitis B. So we've seen most of the STIs we've covered are of bacterial origin, but hepatitis B is caused by a virus, the hepatitis B virus. So it's a potentially life-threatening liver infection, and it increases the risk of liver cancer. So it's quite serious. The transmission is through blood or other body fluids. So this could be transmitted during sex, blood transfusion, mother to child, sharing razors or toothbrushes, or contact with blood or open sore of infected. So you get that even during blood transfusion, the donor has to be tested to see whether they have hepatitis B, because you can't give someone blood containing this. It's very risky. So clinical manifestations of this infection include fatigue, fever, dark urine, lightly colored stool, abdominal pain, and normally the abdominal pain is on the right side, right upper side, because that's where the liver is located. So the right upper side of your abdomen. You can also have joint pain, and some people may be asymptomatic. Okay. So there's hope because hepatitis B actually has a vaccine. So that's one of the major ways it's prevented, especially for healthcare workers who work in hospitals. You may get some people getting needle prick injuries, and this can be a way of transmitting hepatitis B. So these vaccines, these are their names, Recombivax and Epidiolex. So these are the vaccines you can get. And infants actually receive hepatitis B vaccine. So as a kid, you probably don't remember. You probably got this. If you went through the immunization schedule for Kenya, you went through this. So hepatitis B vaccine is given at week 6, 10, and 14 of an infant, and it's given in a pentavalent vaccine, which is a vaccine that contains 5 different vaccines for 5 different infectious organisms, basically. And hepatitis B virus is one of them. Then I think this is the last one for me, vaginal candidiasis, commonly known as yeast infection. So at least women will undergo this at least once in their life, yeast infections. It's caused by a yeast called Candida. This being a yeast, it's a fungal infection. And Candida normally lives on the skin and inside the body, e.g. in the mouth, throat, gut, and vagina without causing any problems. It only causes an infection if the conditions change inside the vagina to encourage its growth. So if there's any disturbance that can set this balance, if also your immune system is weak, you may get candidiasis. Some of the risk factors include pregnancy, diabetes, poorly ventilated clothing, antibiotics, oral contraceptives as well. For oral contraceptives, they contain hormones, and these hormones can cause an imbalance leading to this yeast infection. And for antibiotics, since they clear the microorganisms such as bacteria, they may clear the good bacteria and making you more susceptible to getting this infection. So those are the risk factors. I'll just repeat them one more time: pregnancy, diabetes, poorly ventilated clothing, antibiotics, and oral contraceptives. So if you get a yeast infection, you may want to trace back and see if you have any of these risk factors, but they're not exhaustive. So you're advised to wear cotton undergarments, which is more ventilated to prevent this infection. some of the symptoms for yeast infection include vaginal itching or soreness, pain during sexual intercourse, pain or discomfort when urinating, abnormal vaginal discharge, and in this case, it's usually thick. So you can see these symptoms overlap with many STIs, and sometimes you have to get some tests done to be able to differentiate the STIs. So as I said before, most women will have at least one attack in their lifetime. So it's very common. Prevention: wearing cotton underwear, taking antibiotic medicines only when prescribed and exactly as your healthcare provider tells you. So there's this habit where people take antibiotics unnecessarily. For example, if you have a cold, you do not need to go for an antibiotic. If you have a cold and no other symptom, just a running nose. Some people have been reported to be taking this antibiotic that's very common, amoxicillin, and it's not okay. So when you're taking these antibiotics unnecessarily, or you're not completing your dose, what happens is that there's resistance. If you've not heard about it, now you have. There's antimicrobial resistance. What happens is, let me explain briefly. When you don't finish your dose, for example, it's like you have given the bacteria time to react and gain strength, and they'll start becoming resistant to that drug that you are taking. And if you take antibiotic unnecessarily, it's like you're giving the bacteria doses of something that are not enough to kill it, but it's like telling them, oh, there's this thing that can kill you. So just know. So the bacteria will start mutating and start fighting against the drugs. And before new drugs are actually invented, it takes a very long time and it's a very expensive process. So I'd urge us all to take antibiotics only when necessary, more so when it's prescribed by your doctor or by any other professional that is able to prescribe, and finishing your dose, yeah? So yeah, you'll be helping all of us. So this is just a summary of how to prevent the transmission of STIs. You can limit the number of sexual partners. Some people would also advocate for avoiding alcohol and drug abuse, because when people are intoxicated, they're more likely to engage in risky behavior. You can also talk openly with your partner. You can use condoms. You can get tested to know if you have an STD. You can also get medical treatment to prevent STDs, such as the vaccines. You can also wash your hands before and after sexual intercourse. Just clean yourself, educate yourself. So I'm commending everyone that's here today. You're actually educating yourself, and I hope you've gotten something. Yeah, and also another option is practicing abstinence and using protection when having sex, basically. So there are condoms, there are dental dams. If you don't know what they are, you can find out also that they are used to prevent transmission of STIs. So these are my references. These are just sites that are credible on the internet, especially when you want to find out medical or health issues. So there's CDC. There's also NCBI, this one here. Or if you see National Institute for Health, which is NIH, know that it's a credible site. So that's it for me. I'll just check the chat if there are any questions, feel free to ask before I let my co-speaker take over. Oh, sorry, someone was asking if the screen is being shared. I don't know if you have been following. I hope so. So which is the worst STI besides HIV or AIDS? Wow, what a question. So I feel like it's hard to say which one's the worst, because if they go untreated, they can actually lead, some of them can actually lead to death. Yeah. So for example, syphilis is actually very bad. We've seen the tertiary stages of syphilis can affect different organs. So it affecting your brain, there's a term known as neurosyphilis. That's when it gets into the brain, and it can cause a lot of mental changes. Depending on the part of the brain that's affected, it can actually be fatal, and it can affect the heart as well. And we know the heart is the one that pumps blood to the rest of your body organs. I'd also say that the ones that can cause PID, pelvic inflammatory disease, my colleague is going to cover that. It can lead to ectopic pregnancy, which is really fatal, because sometimes getting the baby to survive during ectopic pregnancy is risky, and it can affect the mother. So in my view, I feel like there are a number of STIs that are very bad. I don't know if I can rank them per se, but I would say syphilis, we have chlamydia if not treated, gonorrhea, chancroid, so which my colleague will cover some of them. We also have HPV, which she'll cover, can cause cervical cancer. That can even lead to death. So there are quite a number in my view. Unless someone has a different school of thought, feel free to comment. Oh, someone also said, I feel like syphilis. Yeah. Syphilis is basically one of the worst. So someone else asked if hepatitis B vaccine is free or paid for. I feel like it depends where you are. If you are a medical student, I know in my case, we didn't pay for the vaccine because we had to go to the hospital wards. But I think depending on where you are and your line of work. Next question is, for the case of teenagers, do we talk to them to know the status with partners? Yeah, I feel like it's very important, especially for HIV. We know that there's a window stage, yeah, can be up to 3 months. So it's very important to know your status, and there's going to be a talk on HIV. That's why I didn't cover it. There's going to be a talk soon. In case you're interested to know more about it. But I think it's very important to know your status, especially for HIV. Supergonorrhea. Yes, someone has been keeping up to date with the with the world. So my colleague will also cover that. What else? About warts. So warts will be covered by her as well. She'll cover genital herpes, which is characterized by warts. Gonorrhea will also be covered shortly. What else? How long can a woman stay with syphilis before it's detected? For years, as we have seen. And the tertiary stage of syphilis can actually manifest itself 10 to 30 years after the initial infection. So for quite a long time. Next. My question is, what happened when you experience blood during sex and you don't feel any pain? So you need to see if there are any other symptoms. If there's blood, it could also be it could be due to some of the abrasions that have taken place during the act, and your partner, I think, would just have to be more gentle. But you need to see if you have any other symptoms. If you don't, then it's not really a concern, but also depending on the amount of blood that's there. So if it's a lot, you definitely need to look into it. If it's not, and it's happened maybe once or twice, it's not something to be concerned about. Okay, is the vaccine offered for free in private hospitals? I'm not sure which vaccine you're talking about. Maybe you can clarify later. And lastly, landscape of STIs in Kenya. What are examples of measures currently in place to curb the spread? Thank you for that question. Very good question. So unfortunately, I don't have much knowledge on that at the moment, but I'll definitely look into it. UTIs will be covered by my colleague, so I will let her take over. If you have more questions, feel free to just continue typing in the chat box. Thank you for your time and for your patience.
Good evening, everyone. I've seen a lot of questions and people are hungry for knowledge about the other STIs, so I'll be covering them in this presentation. So keep the questions coming. I hope you can hear me as well.
Yes, we can.
Okay, thank you. My name is Melissa Butu. I'm a current pharmacy student. And like my co-speaker, I'm also an SRH advocate, and I'm really passionate about female reproductive health. So let's get this show on the road. So as you can see, there are quite many STIs and STDs. We might not even cover all of them. So far in our research, we saw there are about 20 we'll be presenting today, but I'll continue. You can continue asking about the ones you've heard about in case they're not being seen or you've not seen them during the presentation. So I will start with an STI called granuloma inguinale. It's also known as Donovanis. It's a sexually transmitted bacterial infection, but on occasion, it can be spread by non-sexual contact, that is physical contact and so forth. But majority of these STIs, non-sexual contact is quite rare as a method of transmission. Symptoms, usually Donovanis appears about 1 to 12 weeks after infection. You'll see a painful red bump around your genitals that might bleed easily upon abrasion or some sort of friction. And over time, it becomes a round red lump with irregular edges that break into a sore with a very foul smell. So you'll immediately know something's wrong downstairs, and it's actually painful. If it's left untreated, it can cause bone infections, liver infections. It can spread to your joints, causing joint inflammation, You might experience some vaginal bleeding, and it can actually develop into cancer of your genitals, maybe the penis, the vulva, the vagina, the cervix, and so forth. Another one is lymphogranuloma venereum. These are very wordy diseases actually. And this one is caused by chlamydia trachomatis. With symptoms, you see fluid-filled blisters that are small in size around your genitals, and you can have sores in the throat. How do these sores appear? You know, people practice oral sex. So this bacteria can travel to the mouth, the throat, and so forth. And it presents as sores. It's usually seen after 2 to 6 weeks after infection, and you'll observe some swollen tender lymph nodes in men around your groin area. But in women, we see these lymph nodes are swollen around the pelvis, near the rectum, and so forth. Other symptoms include abdominal pain, anal pain, back and pelvic pain. You can experience headaches, fevers, pain when you urinate, and eventually the sores will heal, but they leave scars if you don't treat them with any antibiotics. Complications include anal fistulas, infertility, and blockage of your lymphatic system. Another STI is Mycoplasma genitalium. You can see a picture of how the bacteria looks on the side there. It usually causes an infection of your urethra, your genital tract, and it has symptoms similar to chlamydia and gonorrhea. And it's actually been seen to become antibiotic resistant over time. So there's a lot of emphasis later on I make on having preventative measures, not waiting to look for the cure. Prevention is better than cure, actually. This Mycoplasma genitalium is mostly asymptomatic, so someone might actually go with most of their lives not knowing that they're infected. But if the symptoms occur, usually you'll have dysuria, which is painful urination with burning sensation. There's penile itching. You can observe some discharge from your genitals. In women, there's inflammation of the cervix called cervicitis. There's bacterial vaginosis and PID. So you can see some of these STIs are usually like the first step in the ladder before it gets worse and leads to another STI or another complication. So they're quite layered. You can also experience vaginal discharge if female and itching, pain when you urinate, dysuria, pain during sex, which is known as dyspareunia, fever, and irregular vaginal bleeding. So you're just bleeding on and off outside your cycle, and it's not around ovulation. Then we have HPV and genital warts. We've seen on the news a lot of controversy around this because of the vaccination, but it's been coming to light that HPV, the human papilloma virus, some of its strains actually cause cervical cancer in women, but we will touch on that in a bit. So this is a STI that has about 30 strains that are currently known in the medical world. Some of the strains will cause warts, and others can lead to cervical cancer. You can get HPV via intercourse, via oral sex, or anal sex. Most of the time, testing is done by pap smears in women and HPV tests. You can't tell someone is sick from the get-go. So that's why sometimes they recommend doing regular screening. Prevention, there's some vaccinations that are targeted towards specific strains, and they can help build an immunity against the virus itself. Then they also recommend getting screened regularly and practicing safer sex. So which strains are these, you might be asking? HPV 6 and 11 tends to cause the warts predominantly. So you have flat warts, plantar warts, common warts, periungal and subungal warts. These are basically how the warts look in this, like in appearance. They just kind of describe the warts appearance. Then we have HPV 18 and 16. These ones have been identified to cause now the cancer, the cervical cancer. First of all, it appears as something called cervical dysplasia. This is when the cells of the cervix change in shape under the microscope. When they do your pap smears and so forth, or your, when you go to the gynecologist and they do for your checkup, they can check and they see, okay, the cells around your cervix is looking a bit different than usual. So this cervical dysplasia, this change in the cells surrounding your cervix, if left untreated, becomes cervical cancer. Then there's other forms of cancer that have been observed because of having anal sex or oral sex. You might have throat cancer, you might have anal cancer, you might have penile, vagina, and vulvar cancer. Then we come to genital herpes. So genital herpes is commonly caused by a virus called herpes simplex virus. And it has 2 strains. Like HPV, the way it had 30 strains, this one has like 2 that has been identified. We have the HSV1. They usually call, I think this one is considered a bit milder because it's common. Many people actually have it. And it's the one that causes cold sores, like as seen in the picture around here. When you get a cold, you might have that sore around your mouth that gets crusty, and once you're feeling better, it disappears. It usually comes about because your immunity has lowered at the time, so it flares up. When you get better, it disappears again. Then we have HSV2, which is the main one that causes genital herpes. Though it can cause the cold sores, it's predominantly known for causing now the genital herpes, while the HSV1 causes the cold sores. Now, how does this genital herpes present on a person? Usually it appears like blisters around your mouth, your lips, your face, or anywhere the infection has come in contact with. The area that has contracted this condition sometimes starts itching at first. It's itchy, it's tingly, and then after a while you'll see blisters that appear and they have fluid inside. Then they burst or become ulcerated, becoming sores, which is now the fluid outside. Eventually, you'll form a yellowish colored crust around the sore area, and this is seen about a week after the outbreak. And the lymph glands also become swollen because your immune system is kind of overworking to fight this infection. The viral infection can also cause headaches, body aches, fever. For babies who get this infection, majority of the time through vertical transmission, as my colleague has stated, they'll have ulcers on their face, on their body, on their genitals. If it becomes worse or left untreated, they can become blind, they can suffer brain damage and eventual death. So some of these UTIs, you can see there's nothing, I mean, not UTIs, some of these STDs, STIs, you can see there's no that is really good because eventually they really affect the quality of life and increase the mortality of the person. We come to trichomoniasis. It's caused by a protozoa, like amoeba, but not quite. It's in the same family. It's called by Trichomonas vaginalis. It colonizes the vagina, the urethra, and it's rarely transmitted by sexual means, but it's often an STI. The symptoms and signs include, in men, it's mostly asymptomatic, so they can just become carriers of the infection and spread it. But if if they present with any symptoms, it's usually urethritis, which is the inflammation of the urethra that is seen through discharge, pain when you urinate, and urethral pruritus, which is like itchiness and burning. Complications in men include infertility, prostatitis, which is the inflammation of the prostate gland, and epididymitis, which is inflammation of the epididymis. In women, you have vulvar irritation, which is the irritation of the vulva, the lips of the vagina. You have itching. There's a distinct frothy yellow-green discharge and a musty vaginal odor. Musty can be described as something that's moldy smelling, like when you leave bread in a car, ikakuwa stale. Yeah, that's how you could describe musty. Dysuria, pain when you urinate, and dyspareunia, pain when you have sex. Complications when left untreated, infertility, adverse pregnancy outcomes like stillbirth, low birth weight, complications during birth. There are a lot of things. Postoperative infections as the protozoa moves and disseminates into other areas of the body, cervical cancers. And in infants, if you acquire through vertical transmission at birth, you can result in eye infections. So the child will have like pus around the eyes, eventual blindness if left untreated. Finally, we come to gonorrhea. It's caused by a bacteria called Neisseria gonorrhea. It has stages of development. There's the stage where it's asymptomatic, someone can't really tell they have it. Then it incubates for about 2 weeks, 1 to 14 days, and then it goes into the symptomatic stage where now you can see the symptoms flaring up. In men, you have testicular pain, there's swelling of the testes, there's discharge, there's pain when urinating. Most of these common symptoms, actually, most of the time they need you to have these tests done because you can't be sure if you're suffering from gonorrhea or something else. Then conjunctivitis in neonates because of vertical transmission again. In women, we have inflammation of the cervix, which is cervicitis, urethritis, inflammation of the urethra, discharge when urinating, which is discharge, pain when urinating, and if left untreated, you have infections of the accessory glands. There are some glands around the vaginal opening called Bartholin glands. These are responsible for causing lubrication during arousal and just for general cleaning. So when you have this infection, it can infect those particular glands, causing now infections, inflammation and pain and swelling of those specific glands. A complication now, another complication is pelvic inflammatory disease, which has presentations like low abdominal pain, discharge, pain when having sex and urinating, bleeding between periods and even irregular periods. We'll touch on PID later, fever and infertility. Now, I know all of you have seen on the news the super gonorrhea, but maybe you've just seen the memes, people sharing it, people panicking and so forth. But what has been brought forward by researchers is that early this year, they found a drug-resistant form of gonorrhea when they isolated a sample from 24 sex workers in Kiambu. Out of this 24, there's one particular sex worker who actually had this gonorrhea strain that's not responding to any of the antibiotics that you use. Most of the time we use antibiotics like ceftriaxone, and ciprofloxacin, but they're not working at all. So this particular strain, if you can get a bit technical, has a protein mutation that in a particular protein called penicillin binding protein 2 that helps the antibiotics work. So this bacterial strain, this particular protein is kind of smart in quotes, and it doesn't bind to the drug, so the drug doesn't work and it can't exert its action in the body. So unlike the typical gonorrhea, this one can actually be asymptomatic. So people can actually be walking around not knowing they have super gonorrhea, but it's still causing havoc because years later you might find you've developed the complications that we saw earlier, like PID, like infertility and so forth. So you really are not sure what's happening. So there's emphasis on having safe sex and going for regular screening with your partner. When if you're keep one partner if possible, go for screening, just avoid getting these strains, these STIs in general. Then we have scabies. Like lice, this is caused by like a parasite outside. It's usually known as an ectoparasite. It's caused by burrowing mites called Sarcoptes scabiei. It's contagious and spreads from person to person. So it can be spread through non-sexual means, but it can also be spread during sex and so forth because you're touching the person. You can find it in the armpits, you can find it around the waists, the insides of your wrists, your elbows, the soles of your feet, around your genitals, and so forth. Symptoms usually include itching that's severe, usually at night, because there's a lot of movement by this parasite to sickle when the parasites, females, are trying to lay eggs and so forth, and feeding on the skin and the dead skin cells and so forth. So you'll find you have thin wavy tunnels on the skin that's made up of tiny blisters or bumps. Then we have UTIs. UTIs can come about through various ways, sometimes through holding of urine for too long because there's colonization or overgrowth of bacteria. It can be passed through someone having a UTI, passes it through sex or intercourse and so forth. It's an infection involving the whole, genital urinary tract. So it's the kidneys, you have your ureter, your bladder, and your urethra that can get a urinary tract infection. So it usually climbs up from the urethra, then it goes to your bladder, then it goes to your kidneys and ureters. It just climbs up if left untreated. So initially it presents like a strong urge to urinate, like you constantly want to pee, but you're not even when you're not taking much water, you just want to pee. And when you do go pee or urinate, it passes small amounts of urine. The urine itself can be very strong smelling or cloudy. It's not clear as normal. You feel a burning sensation when peeing and urinating. There's pelvic pain and it can reach, if it reaches the kidneys, like after it has ascended up the urinary tract, it can feel like back pain, high fever, shaking and chills, nausea and vomiting. So for UTIs, common recommendations is to drink enough water, to go for regular screening, see your doctor as soon as possible. Don't hold urine. Immediately you need to urinate after sex, because urinating after sex decreases the likelihood of developing. It might not prevent a UTI, but it decreases the likelihood of developing a UTI infection. Then we come to pelvic inflammatory disease. This is a serious infection of the uterus, the fallopian tubes and or the ovaries. It can be a complication of multiple other STIs like gonorrhea. The symptoms include pain or tenderness in your stomach or lower abdomen, the belly, and it's usually the most common symptom that you're suffering from PID. There's also abnormal vaginal discharge. There's usually a yellow greenish discharge with a very unusual odor. As you can see in the picture, a normal fallopian tube is relatively smaller in size, but in the inflamed fallopian tube, it's swollen, it's larger. And because of this anomaly, you can get scarring inside your fallopian tube. And that's what causes now the ectopic pregnancy, because the passage of the fertilized egg is impeded, it's obstructed. So the egg, of course, the fertilized egg will implant where it can. It will implant in the fallopian tube. So other symptoms include chills or fever, nausea and vomiting, dyspareunia, which is pain during sex, burning when you pee, irregular periods or spotting. Spotting is usually you see a bit of blood on the undergarments outside your menstrual cycle. You know you're not supposed to have your period, but there's blood. Then there's cramping throughout the month. Complications, if left untreated, is chronic pelvic pain. So you're in constant pain, constantly. There's ectopic pregnancy. I've explained how it occurs. Infertility because of scarring of these fallopian tubes, scarring of your uterus. Thus, even implantation of the fertilized eggs is not possible. Then there's tubal ovarian abscess. All right, thank you. As a closing off, I'd emphasize prevention is better than cure. Practice safe sex. As you've seen, there's a lot of antibiotic resistance. Most of this, back in the day, most of these STIs and STDs were very treatable. You just take some antibiotics and it's gone. But nowadays, when they do testing, they find that most of the STIs do not respond to any of the antibiotics available. So to conserve the few drugs we have, we should try practicing safe sex, checking on our statuses, with our partners, confiding in our partners if we have an illness and so forth. Thank you. If there are any questions, please share.
Just to add, there's a link that has been sent in the chat. It has about 6 questions just to gauge how much you've understood and how much you know about STIs, mostly from this session. So please feel free to answer. It takes a very short time. It's multiple choice, and maybe in the next 5 minutes we can just confirm the answers.
I have a question concerning the topic of today. Can I speak? Can I go ahead?
Yes.
Yes, I'm referring from Migori County, working with an organization called Three-Way Care Foundation. And we are working with the young people, actually working with young people from age 9 to 24. And my concern is packaging on the information, because remember, we are working with young people, and young people, they don't, how do you engage them? Maybe how do you relate? Maybe what can you say about the behavior change and communication of young people towards the STI issues? Because it's very common in young people, more so the syphilis and the gonorrhea. There's a number of cases that we have witnessed concerning the STI, the syphilis and gonorrhea. So just the approach, because you are speaking about we are going to kind of take whatever we gather here back to our community to talk with our young people. And how, as somebody who is giving us all these things, because we are now like TOTs, you are training us to be the trainings of others. What can you say about the package, maybe the behavior and communication toward the STIs in young people?
All right, that was a lovely question, Roy. My 2 cents is actually I found it very interesting while I was preparing the slides for today. I was with my 13-year-old brother, and he could actually recognize majority of these STIs. They have been taught in school, and I thought that was a very interesting shift in our education system. I think in regards to packaging, they started like staircase in a staircase fashion, having basic knowledge on the reproductive organs, first of all, the way we learned in primary school in standard 6. They have that basic understanding to begin with. And then leveling up, you can now introduce the commonalities, try and describe the symptoms. And for higher level, youth, you can now introduce pictures of the illness itself. Though that might be a bit graphic, but we have to try using stepwise fashion in introducing and bringing the knowledge. Because I think a fear we have as a society is that the children or the youth might not be able to comprehend what is brought forward, and they actually can. They can't comprehend what they're being taught, and I don't think it needs to be too watered down, but it should be adjusted to their I don't know if the word is intellect, but their current level of understanding. I don't know if my colleague or my co-speaker has something to add.
I think you've answered the question really well, unless the person asking may have another follow-up question. I have nothing much to add to that.
Okay, thank you so much. The second question is going to the UTI. We experienced sometimes back there was high cases on maybe the first teen mothers experiencing, maybe there was high cases on UTI. So I don't know what, maybe if you can advise, maybe you can say something about that. What could maybe might rise to such kind of cases? Because we have a program on teen mothers. We call them first teen mothers here. And we were assessing the situation. We realized there was high cases. There are a lot of cases on UTI. Yeah, I don't know what could have been the maybe cause of that. Maybe if you have any insight, maybe anything, maybe you can say about that, you can share as well so that we learn from it.
Okay. In regards to UTIs, there's something they actually didn't mention. Maybe you can also approach the hygiene portion of basic personal hygiene, because we are taught a lot as young girls that we should wipe, for example, from front to back and not back to front. From the anus towards the vagina is a no-no. You should wipe from the vagina towards the anus, so to avoid the introduction of bacteria from the back end to the front end. So probably the increase, this is just a hypothesis, is that the increase could have also been, how are they taking care of the personal hygiene? Are they also doing douching, which is the process of like inserting a lot of fragrant soaps, inserting of water, and using a lot of products, hygiene products as well, to clean the vagina in the area, the genital area. So maybe seeing if you can tackle that area first of all, and also maybe having them monitor a lot of their, monitor the frequency of the UTIs. Because I noticed is that like young girls don't know much about also their own menstrual cycle. So if they could be able to do a lot of tracking of their own changes, reproductive changes, it might help identify patterns, first of all, that are contributing. Maybe they notice this, my UTI or this UTI happened on this month, what changed? And that way you can be able to actually zero in on the cause for the infection or the flare up of the infections.
Thank you so much. My third question, can we say that women are the most spreader of gonorrhea than men?
Please repeat your question.
My third question is like, because the women stay long when maybe if they have the gonorrhea or the syphilis than men. Men will experience maybe after a few days or maybe after maybe a few days kind of, and women can take long maybe to experience it. So can we say that women are the people who are the spreader compared to men, because they meet different people and they're staying with this for long? So can we say that, conclude that the people who spread the gonorrhea and the syphilis most than men?
I would disagree, because for the syphilis, for example, we did not categorically say that it's women that are asymptomatic, but both men and women. So depending on your immune system and other factors, being asymptomatic when having syphilis, for example, or gonorrhea, does not really depend on your gender per se. It's chlamydia, for example, and chancroid that we mentioned that women are more likely to be asymptomatic. So I wouldn't say that it's women who are more likely to spread it now for syphilis and gonorrhea.
So how long can a woman take with syphilis before detect, or gonorrhea?
So I can speak for syphilis. We talked about the primary stage, and we said that a person may stay up to 90 days before the symptoms show up. Now for the primary stage, and for syphilis, it starts with the painless chancre, the painless sore. And this sore can appear, and the lady or man may notice it, but then it heals within 3 weeks and they think, they're okay. But then slowly they progress to the secondary stage where they have non-specific symptoms such as fatigue, headache, and some rashes. And it may also resolve, and then they think they're okay. Without treatment, they can still progress to the asymptomatic stage and further to the tertiary stage where there's organ damage. And for them to reach the tertiary stage, it takes years. It can take up to 30 years. So the symptoms may be there, but then there may also be periods of dormancy. So they can go without the knowledge that they have the condition. So it can be up to years in my view, if they ignore the symptoms.
Okay, thank you. What of the men? How many days or maybe can men take to detect? Because there's something I'm kind of just want you to clarify, kind of.
How long men will take for syphilis?
Yeah, to detect that.
Okay, I was speaking for both men and women. So from what I got, from my research, I got that both genders, there's no significant difference. So it still applies to men. If they ignore those symptoms like the sores, the initial sore, the rashes, or the other minor symptoms that accompany the infection, they can still have it resolving and entering an asymptomatic stage where there are no symptoms completely till years.
Okay, thank you.
Okay, thank you. Sorry, I've seen Ruth raised her hand, then we'll answer the ones in the chat box. Ruth, go on.
Okay, good evening, everyone. I have 3 questions. One is, when ladies are cleaning themselves, taking a bath, can you remove the wash inside your genital removing the white stuff, because some say it's good. I don't know. Some say you can use yogurt. Some say you can use salty water, but I know you can clean with very clean water. Is it good to just remove the white stuff when you're cleaning your genital?
Okay, thanks for that. Yes, it's very okay to clean. Basically your genital area, remove that stuff. It's advised to use your hands instead of the face towels. That is ensuring that your hands are clean, and using plain water is enough. So you do not need to use any other solution or mixtures of liquids. Just plain water is enough.
Okay, there is this disease I saw. There's a man who had the penis was peeling off. I don't know what kind of STD is that. It was just the flesh was like coming out. You know, men, when they get infection, it comes out very quickly. So there was this, I didn't know what kind of disease it was. It was like the flesh was just oozing out. I don't know what kind of disease is that. And for another one, there's a disease that was detected in, I don't know if it is Busia or Malaba, the one that I don't know, it's called Jakababa or Jaka something. Does it have a vaccine?
Please repeat that name.
And they were calling it on television. I don't know, Jaka.
It was Jakadala. It was Jakadala detected again. Even in Masarai, Migori County, we had that case called Jakadala. Yes.
Jakadala.
Yes, of course.
Jakadala. Yes. Does it have a vaccine? It seemed very, very, very severe because it was taking off the manhood. And I don't know how it worked for women, how it was like affecting the women. I would like to know.
Would you know any other name apart from Jakadala? Because personally, I have not come across it.
Okay, there's this disease, they said it's sexually transmitted, that it eats up the manhood. It eats up completely. So I was wondering, for women, was it doing the same, taking out the flesh outside, or how it was working? Because it was termed as very severe, but they were saying it in that term. The guy has just corrected me, but I didn't know the scientific name for it. The one that eats up the manhood. So I don't know how it works for women.
I am not really sure which STI that could be, unless my colleague Melissa could answer that. But I do know that there is an incident where someone had gonorrhea infection, a man, and it was very it had gone untreated for so long that the man was oozing out certain. Basically, our lecturer told us that the man even had a bone coming out. So it was that severe because it was eating up the insides. Yeah. So I'm not really sure if it's similar to what you're describing. Melissa, would you?
Before Melissa, Jakadala is a musician. He's a Luo musician called Jakadala. And this guy was, I think it happened because Jakadala is being said it's more of just a gonorrhea, and it was a gonorrhea that was kind by the time the guy came to do music stuffs in Migori, Uganda, via not Rusinga, but Migingo Highland to Migori. And that is where the outbreak was. It was in the magazine. It was everywhere. The issue of Jakadala, and Jakadala is just a musician. I think that it was detected when the guy went to perform. So that's the way the name came up to Jakadala. But it was just one of the gonorrhea kind of, it was gonorrhea, yeah.
Thank you very much, Roy. You have cleared the air very well. So seems it was a gonorrheal infection. I hope, Ruth, you answered.
Yes, and it was termed that it was uncurable. It was eating up the manhood. So I was wondering for women, like it was doing what? I think the gentleman knows well, he can answer me. For women, how was it reacting to them?
It's funny, I tell you. I'm not aware about because I'm not aware how it's maybe happened to women, but I'm only aware about the man who maybe it was almost cutting the stuff out. The only that it was spreading was moving very fast. It was eating the man very fast. I don't know. You guys, you can tell us the type of gonorrhea that always go at that speed, because even me, it was a surprise to us. We've never seen such kind of thing. Yes, I don't know if it's a super gonorrhea. I don't know it is what. You guys, you can tell us about it. But what I know, it was a gonorrhea kind.
I think it's just going to show that if you don't get the STI treated as soon as possible, it can end up affecting other parts of the body, and it can lead to some severe complications. So, as Melissa explained, that there's a new strain of gonorrhea, so it could be the same, it could be different. I think that demands more research on the same, but at the end of the day, we've seen that gonorrhea can lead to quite severe complications. So I would say delayed treatment is the major cause of these results.
Okay, the last one I have is it okay for a lady, like some do this, they take the cotton wool and they squeeze lemon and they add some warm water and they put, they roll the cotton wool in the water and then insert themselves. Is it okay?
No.
Is it hazard?
You've said lemon juice.
Lemon, yeah.
Okay, so lemon is of acidic character, and the vaginal region is normally acidic. But you already have normal flora, which is the good bacteria in that area that ensures that the acidic environment in the vaginal area is maintained. So when you introduce other chemicals, you might be upsetting the balance, yeah? So it's not necessary to do that. So just pure water cleaning without any other additives is sufficient. So I would advise not to do that.
Does gonorrhea, since it seems that it is multiplying, does it have a vaccine?
No, that's actually in the quiz. Currently, there's no vaccine for gonorrhea. Yeah, there's no vaccine yet.
Okay, thank you. That's all. Thank you very much.
Thank you. Thank you for your enthusiasm and questions. I'll just answer one question in the chat that someone was asking, can men get yeast infections? Yes, they can, because Candida does not discriminate apparently. So men can also get yeast infections, and some of the common symptoms of STIs, such as the burning sensation, the irritation when peeing, can be the characteristics. And they can get it when, for example, when they have sex with a lady who has now the infection, for example. Someone also asked something to do with UTI and pregnancy. Maybe Melissa, you'd want to take that question.
I wish you would all go to schools and teach our children this, because they're like very shy like my son, when I try talking to him about sexuality, he's very shy. He says he's not comfortable talking to me. So I wish you go to schools and teach them.
Thank you. I think education is very important, especially at a young age. Definitely something to consider in the future.
Yeah, it should be done urgently because we are having teens who are growing sexually active. We don't, like me, I'm a single mom. I don't know how to teach my son how to use a condom. I don't trust anyone to go and teach him how to use a condom. I think the school will do better. Like me, I learned from school. I learned from primary school and secondary school. My girls, I learned, you were taught everything about even condom for girls. It was brought, you were taught. But nowadays, it's not because they change the syllabus. There's no even radio lessons. There's nothing like that. They could listen and learn. It is just, I think you should do something about.
Thank you for that concern. We'll definitely discuss with the team. Godfrey, are you asking a question? Okay, clearly, I think he unmuted by mistake. There was one question on UTI and pregnancy. We said pregnancy, I believe when you're pregnant, you're at a higher risk of getting UTIs, just like you're at a higher risk of getting yeast infections. But Melissa may add on that if she wants to. And how a man can cause a lady to get UTI or something like that. I saw such a question. So men can introduce bacteria through vaginal sex, oral, or even through their hands. So such bacteria may end up climbing up the urethra and causing the UTI. And the difference between STIs and UTIs, STIs just from the name are mostly transmitted sexually transmitted infections, but UTI may come as a result of maybe worsened by sex, yeah? But they're not necessarily the sexually transmitted infections per se. They may be worsened by sex, and that's I think that's not the main mode of transmission. But Melissa, do you have anything to add? I think you've raised your hand.
Okay, just to emphasize on your point, yes, women who are pregnant have an increased likelihood of getting UTIs, but being pregnant does not mean you have an UTI immediately. But during pregnancy, as you can see, the body undergoes a lot of changes to accommodate the growing fetus and in preparation of birth. So there's a lot of changes, like your urine concentration changes, your immune system changes as well. It can get weaker slightly. So you're more prone to actually getting a bacterial infection in your urinary tract. So women who are pregnant between the weeks 6 and 24 are advised to just take good care of themselves, drink enough fluids, all the precautions that we recommend other women and men of reproductive age or even younger to just try and take into consideration to prevent a UTI.
Thank you very much. That was well explained. Ruth, your hand is raised again.
Okay, I was asking, I just remembered the time I was working in the clinic, and many women are giving birth.
Hello, Ruth, you're
They
breaking.
were like, I could see some kids they being they have there are some like we tend to have that where they come
Hello?
from another child.
Excuse me, Ruth. You're breaking. We can't hear you properly.
Can you
You're still
can
breaking,
you hear me?
not clearly. If you could
Can you
maybe
hear me
no.
now? Can you hear me? I can hear you now. Now
Just speak once again. Okay, I think she's accidentally left. Hopefully she'll chat in the box. I think we should just go through the questions left. Sorry, the small quiz that we had, unless anyone has another question, because of time. So the first question was, condoms prevent all STIs, true or false? 20% of the people said true, 80% said false. So the correct answer is anyone want to say, or we just go on?
I think it's false because I think there's a statement you say about the lies. The lies where you say because the condom does not cover the whole area, you can still contract the what was the name? Crabs.
Very well
Yes,
said.
yes.
Thank you so much, Mercy. That's very true. And sometimes some of these sores may occur in areas that the condom does not cover, and it may still lead to an infection. So condom does not prevent falls. So that's false. Second question, syphilis is characterized by a painless sore. So 90% of the people said yes, 10% said no, it's painful. I guess when you before you knew, you'd think syphilis sounds very scary, it must be painful, but that's not the case. It's painless. Then thirdly, genital herpes is curable. So here there was a tie, 50% said true, 50% said false. Genital herpes, which is a virus, is unfortunately not curable, but what the treatment does, and I believe Melissa can speak more on it simply suppresses, and the herpes virus basically hides in the nervous system where the immune cells cannot get to it to completely eliminate it. So it usually just remains dormant in the body until it's activated later when your immune system is weak. So it's not cured completely. So the answer there is false. 4, women with chlamydia are mostly asymptomatic. 80% said true, 20% said false. So majority wins in this case. It's true, women with chlamydia are mostly asymptomatic. Then which STI has no vaccine? The answer, after it was answered here, is gonorrhea. So 80% got it correct. And finally, the last, that was the last question, I believe. So all I can say is thank you so much for your time, for your participation, and I hope at the end of the day you've learned something. That's it from me. Melissa, you may add something small to finish.
Thank you guys for attending today. I think public awareness is the first step to building a healthier society. So if we can start with the adults, it will be good, because I think as adults we don't take some of these illnesses seriously until we are unwell ourselves. And if we can't take it seriously enough, how will our children and those who come after us take it seriously? So we empower ourselves, and then we can empower the descendants or the people who come after us later on. So thank you for coming today and share what you know, share the knowledge. Ruth, I've seen you raised your hand.
Yes, I'm back. I was asking those in hospitals, see kids like they would have some so like pus coming out from their eyes, and the mothers didn't have gone any STI, but I want the reason why. Another, I would like for the so I attend.
Please type your question in the chat box, Ruth. It seems that you're still breaking. We did not get you clearly. If you could please type it in the chat box. Thank you so much for your question. Has been well received. You're asking why majority of mothers give birth to babies who ooze out pus in their eyes. So this is a common symptom of gonorrhea and which is this other one? Chlamydia. So a mother can actually transmit it to the child during childbirth or even through the placenta. So this may lead to infection of the eyes, leading to pus formation. Yes, Melissa, go on.
There's also, if because I had like Ruth was asking, what if the mother does not have an STI, but this child is still presenting with a pus in the eye? Sometimes they might get an eye infection, conjunctivitis, and it might be caused by some bacteria that we usually have on our skin called Staphylococcus aureus, Staph aureus. It's commonly found on our skin. We have it normally, but if we have low immune system or cuts or wounds, we might get, infections. So sometimes during birth, this Staph aureus gets into the eyes, causing conjunctivitis. So it just moves from the skin towards the baby, the eyes. There's also another one called Pseudomonas aeruginosa. It can also cause this conjunctivitis of the eye. So it's not necessarily, but most commonly, rarely, the conjunctivitis of the eye is an STI. Mostly, commonly, it's an STI, but rarely it could be Staph aureus or Pseudomonas. So how do we prevent it? Okay, during the birth, you can prevent, the doctor themselves can also prevent, touching the baby with unclean hands during the birth process. So they recommend frequent hand washing or wearing the gloves, cleaning the eyes with some solutions like saline, which is like a salty solution, but the doctors will take care of that. And consulting a doctor immediately you start seeing that symptom so that they can treat it as early as possible. But mostly it's just being clean and screening, as Nabila said, screening the mother for STIs during pregnancy. That's another way for preventing this occurrence of the conjunctivitis. Salty water to clean the child. The child's eyes or the body? Sorry. I think using just plain water would be recommended. I'll have to research more on that because the water we make at home, it could be too strong for the eyes of the child and it might irritate the eyes. So just using clean boiled water might be better to clean the eyes than using salty water, because most of the water we use in the hospital has been adjusted to match the parameters of the body. So if it's too excess, it might damage the tissues and the organs.
And just to add, once the tests have been done and it has been confirmed whether or not the mother has an STI, such as gonorrhea, there are certain antibiotics that are applied and they are very effective. So they can be applied on the baby's eyes after prescription by the doctor. I'll just repeat what I've said. I think you're asking about that as well. If the tests are done and they confirm there's a certain STI such as gonorrhea or chlamydia, there are certain antibiotics that are applied to the eyes, and these are prescribed by the doctor, and they're very effective in treating the eye infection. I think we'll have to wind up now with this final question from Ruth. She's asking, what damage can salty water do when cooking for an infant or even drinking it? I believe not much damage, since our body contains some of the ions that are included in the salty water. So, of course, not advocating to take large amounts of salty water, but if it's a little, it won't do much harm. But I don't think there's a situation you'd be giving an infant a lot of salty water.
Oh, can I answer that question?
Sorry, yes. Go ahead.
So we came from our pediatrics rotation, and I used to think that salty water was also okay, but actually it's not. What happens is, generally, for young children, you should give them plain water. Because salty water is hypertonic, which essentially means, for those of you who don't know what hypertonicity is, it sucks water from cells around it. So if a child drinks salty water, it will suck water from the gut and they will diarrhea. So Nabila, you're correct. A little bit is not that bad, but a lot is not good. Especially if they're diarrheaing, you shouldn't give them salty water. Yeah, thanks.
Thank you, John. That's a very good explanation. I think that is it. Unless someone has a very burning question. Okay, thank you so much for your time again, and it was a pleasure. Feel free to exit.